Hello and welcome. Following the gradual relaxation of the lockdown, it is pertinent more than ever for us to continue to take responsibility for our health, meaning we should continue to adhere to the precautions already stipulated by the federal government to curtail the spread of COVID-19. The elderly are a group of persons that are at risk of contracting infections, and if they do, they might manifest a more severe disease and usually have a less than satisfactory outcome. Today, our discussion is going to center around the elderly. I am Dr. Igenigbai Cyprian, and this is Inside Health.
Lenva antibacterial sanitizer spray.
Welcome back. The elderly are persons who are 65 years of age and older. These persons, they are prone to contracting infections, and they usually manifest a more severe disease and usually have a more unfavorable outcome for several reasons. First of all, there is an age-related steady decline in the physiological reserves in virtually all organs in the body. And this reserve is what is called upon in moments of stress, for example, infection, such that when these persons get infected, they are easily overwhelmed and can manifest multiple organ dysfunction or even death. Another reason is because these persons are more likely to have a second medical conditions such as hypertension, diabetes, cancers, arthritis, visual problems. And today, I'm going to focus our discussion on hypertension. Simply put, hypertension is a situation where the heart pumps blood through the arteries at a much higher pressure. And this will lead to changes in the heart and in these arteries, and such that a vicious cycle ensues. There is a type referred to as the essential hypertension. And the risk factors for these include a family history of hypertension, obesity, use of alcohol, use of cigarettes. And among these factors, there are some that we cannot do anything about. For example, the person's age. We have no control of our age. It's a natural process. Or if you have a family history of hypertension, you are at an increased risk of having hypertension by yourself. All right. Also, the race. It is more common among the black population. There are some risk factors that we can do something about. These include the use of alcohol, smoking, living an inactive lifestyle, obesity. So how does hypertension manifest? Most times it is silent, in that it gives no symptoms. And this is why it is very dangerous, as it's a silent killer. Because the first time you show symptoms might be a complication, and these are usually catastrophic. Also, it can manifest as recurrent headaches, which we most times overlook. You might have palpitations. That's when you feel like you can hear your heart beat. So the complication of hypertension, why is it so dangerous, and why is it an important issue? As the heart continues to pump this blood at a higher pressure, it begins to adapt to the increased workload. All right, and it becomes bigger. Because heart is largely a muscle, so the muscle becomes bigger. But as this goes on, the heart starts to decompensate. It starts to become flabby, and it's unable to push this blood across the artery and it begins to fail. And when the heart fails, it can manifest in several ways. First of all, it could manifest as breathlessness. You find that when you do any little activity, you see yourself breathing heavily. Alright? It gets to a stage, as it progresses, it gets to a stage that even fastening your buttons, you get breathless. It can also manifest as cough. You cough and you produce white foamy sputum. Alright? It can also manifest as fluid accumulation around your abdomen or in your legs. You'll be having foot swelling or leg swellings known as edema. Hypertension can also put you at risk of having myocardial infarction or heart attack. It can put you at risk of cardiac arrest also. Then as the heart continues to pump this blood at a higher pressure through the arteries themselves begin to respond to this increased pressure. They begin to get thicker. The lumen, which is the caliber, begins to get smaller. And some substances begin to get deposited along the walls of this artery, so that you have an artery that has a smaller lumen, it is less elastic. So an artery that is not elastic is more likely to get ruptured, can get burst. Also, the body suffers from the chronic effect of reducing decreased blood flow over a period of time. And this substance in the wall of the artery can easily break off and is propelled along the vessel. When it gets to an artery where it branches to a smaller artery, this substance can block these arteries and the organ will suffer from a result of interruption of the blood flow. So when the artery is going to the brain gets ruptured, you get what we call a hemorrhagic stroke, and this is devastating. If this happens in the heart vessels can get blocked and you get a heart attack. Even the eyes are not spared. This can lead to visual disturbances. And the kidneys also, they begin to get what we call sclerosis. They begin to get harder and smaller. They begin to shrivel and shrink, and it can lead to chronic kidney disease requiring dialysis or a kidney transplant. Hypertension can also affect the vessels that take blood to the legs, such that when you have an injury or you have a surgery done on your leg, the wound will refuse to heal. You can also have wounds in the legs that will refuse to heal due to a diminished blood flow to the legs. So what do we do to avoid these complications? If you have a risk factor, a family history of hypertension, perhaps your father, your mother, or your siblings, you can get to see your family doctor for screening. Screening is an evaluation to detect the disease before it manifests symptoms. So you go for screening, and it puts you on a program, on a regime of regular follow-up in order to catch the hypertension before you get complications. You can also live a healthy lifestyle. You watch your weight, you watch your diet, and you avoid smoking and alcohol. My name is Dr. Igenugbai Cyprian. This is Inside Health. Don't forget, continue to stay safe, continue to adhere to the precautions already stipulated. I'll see you next time.